Technology is developing at an exponential rate, but physical therapy is not keeping up. Our therapy sessions are only a snapshot of the patient's progress. Our therapy sessions should be more of a consultation of the quality of the patient's movement outside the clinic, and this definitely can't happen.
Robbie here is a robot primarily used for neuromuscular re-education in patients recovering from neurological injuries.
The best part about it is
Robots allow simple movements that can be practiced over and over. Here, Robbie is used in a patient recovering from stroke. The robot assists and guides the motions programmed to occur and then provides a detailed kinematic report.
The challenge is we need a way to package and document all of this information and send it off to insurance. And we need a way to program these devices to help our patients do everything in the 71 hours between therapy sessions. Telemedicine can also take advantage of this information in providing further consultation. But again, we need a way to document and bill all of these sessions.